The C in the slick valve evaluation stands for collateral injury. This is where you want to think what structures are close by anatomically to the mitral valve that could have been injured at the time of surgery. This would include the left circumflex artery, the aortic valve, the coronary sinus, the conduction system or AV node. For the collateral injury assessment, look at LV systolic function, and in particular, looking for regional wall motion abnormalities, as a regional wall motion abnormality in that lateral, infralateral segment could indicate the left circumflex injury. Frequently, there's a suture that can compromise that left circumflex artery around the annulus. Also, to round out our ventricular assessment, look at RV function to ensure that there's no stunning that occurred from the time spent on cardiopulmonary bypass. In addition to ventricles, we're going to look at valves that could have been injured as well. We're going to assess to see if there's any new or worsened aortic regurgitation. There can be suture damage because of the close proximity of that anterior mitral valve leaflet to the non-coronary cusp and the left coronary cusp of the aortic valve. Those sutures can catch part of the aortic valve and actually cause new regurgitation. Also, we'll assess the tricuspid valve. As we mentioned, sometimes these valves can be addressed at the time of a left-sided heart surgery like a mitral valve replacement surgery, and we'll look to see if there's improvement in the tricuspid regurgitation either with or without intervention being performed. There's a few other miscellaneous things we'll look at in the collateral injury category. Anytime a patient had a cardiopulmonary bypass run, we'll want to make sure that there's no dissection seen in the aorta after the fact and after you're off cardiopulmonary bypass. We'll want to assess the interatrial septum as well, as some surgical approaches can accidentally leave an iatrogenic ASD. Lastly, we mentioned patients with mitral valve pathology can have atrial fibrillation, and so frequently these patients will have left atrial appendage clips or occlusions. Make sure that there is successful clipping at the time of mitral valve surgery, that there's no or minimal residual flow in there, that there's an appropriate stump length to ensure that the patient is at reduced risk of thrombus at that location.